Welcome to our lecture series. Hailing from Vancouver and receiving his medical education in Canada, Dr. Gabor Mate practiced family medicine and palliative care for 20 years before transitioning to a challenging career in the community treating addiction and mental illness. Informed by his clinical experience and expertise in addiction, trauma, childhood development, Dr. Mate is the author of several award-winning and best-selling books translated into 25 languages. His writing, which gets to the heart of suffering, describes the relationship of stress and illness in a way that resonates across disciplines of science, medicine, and the humanities. More recently, Dr. Mate's curiosity led to involvement with an ayahuasca center in Central America. His experience there has informed his outspokenness about the potential of psychedelics for addiction, as well as other medical and psychological suffering. Today, the director of our Center for Psychedelic Psychotherapy and Trauma Research, Dr. Rachel Yehuda, will speak with Dr. Mate about trauma, chronic health conditions, and the potential of psychedelics. To those streaming in, please type your questions in the Q&A, and we will call on you at the end to come up to the stage to discuss with Dr. Mate. Thank you.
Thank you. First of all, it's wonderful to be here. I appreciate the welcome and the invitation. It's not quite true to say that only recently that I get involved with ayahuasca. In fact, I've been working with psychedelics for about 12, 13 years now. And I will begin by giving you a case history. Now, put on your seatbelts, because I don't think anything in our medical education prepares us to understand the trajectory of this patient whom I'll tell you about. This is somebody I've been following for years. When I say following, not as her physician, she's in Boston, I'm in Vancouver, but following her personal story. And I've been in touch with her physician in Boston as well. So she verifies all the medical details. But as I tell you the story, first of all, in a brief form, see what in your own view and perspective and in your education and in the medical ideology in which you work, what might explain this particular story. So this patient, whose name is Meok, M-E-E-O-K, that's her Korean name, grew up in Boston, or grew up in the United States, and she was an executive to a high-level academic at Harvard, when in her late 20s, she developed stiffness and joint pain, inflammation, and was subsequently diagnosed with scleroderma or systemic sclerosis, which, as you know, is an autoimmune condition that affects the connective tissues of the body, and literally it means hardened skin, which is exactly what happened to her. She became stiff. When I say stiff, the first time I spoke to her, quite some year, about 6 years ago now, her face was like this. And at her worst, she described herself as a mummified body in pain. She could not get out of bed by herself. She was completely wheelchair dependent to mobilize and had to require the assistance of others, even to get out of bed. The anti-inflammatories didn't work, the steroids didn't work, the immune suppressants didn't work, which just about exhausted the armamentarium of Western medicine. And all she wanted to do was die. In fact, if she had had medically assisted death available to her, she would have chosen it. And she had no prognosis whatsoever. Okay, today she's walking around, she's hiking, she's writing her biography, she's smiling in her impish smile again, and she's independently mobile, active in her life. Just won a poetry contest. This is without any Western medical help, which didn't help her. Now, how is this even possible? One night, she did ayahuasca. She somehow obtained it. She got it. She drank it. That night, she stood up by herself for the first time in 6 months. And that began her journey. Now, she also read my book, When the Body Says No. That's where she got in touch with me. And she's been on many healing journeys since. She's had physio, she's had more psychedelic experiences. She's had therapy. She's done a lot. But the point is, she's not the same person she was. And she's certainly not dead as she would have been otherwise. Now, I'm just wondering, just ponder for a moment, what in your medical education or your scientific training would allow you to account for this particular turnaround? Now, the Harvard psychiatrist, Jeff Rediger, who's the head of medical director at McLean's Hospital, published a book last year called Cured, something about the science of spontaneous remissions or spontaneous healing. And it turns out that there's nothing spontaneous about these cases of spontaneous healing, nor is it spontaneous in the case of Mioke. So how do we explain it? Well, we can't explain it simply by the pharmacological action of this particular Amazonian concoction called ayahuasca, which is a combination of the ayahuasca vine and the chacruna leaf. There's no pharmacological explanation for her improvement. But from my perspective, and from the way I've understood illness for a long time now, there's absolutely nothing surprising about this. Why not? Because what I've learned is that illness is not some random event. It doesn't simply come along for idiopathic reasons. Idiopathic simply reflects our ignorance of what causes illness or what potentiates illness. But of course, it doesn't explain anything. And even the way we think about illness, whether it's of the mind or the body, there's biases built in it. Now, if I say somebody has scleroderma, or somebody has ADHD, with which, by the way, I've been diagnosed, or somebody has depression, or somebody has multiple sclerosis, we're kind of making an assumption. And the assumption is that there's the somebody here, and then there's the illness over here, and somehow this entity here has got this other entity here, but they're separate entities. And this one has a life of its own. So I have here a cup of coffee. It's not part of me. I can put it down. I can drink it. I can do whatever I want with it, but it's not an aspect of me. But what if illness is not something that we have or that enters us mysteriously or for some unknown reason? Particularly, I'm talking about chronic illness here, such as autoimmune disease, such as malignancy, such as mental health conditions. What if what we call illness actually represents a process that occurs inside a particular individual, and that process reflects and manifests that person's life from the very beginning, from even conception, and that the illness is a manifestation then of a lifelong process that is completely connected to what happened to that individual throughout the course of their lifetime. Now, here's the thing that none of Mioke's specialists in Boston had actually thought to ask her about, which is what happened to you in life? So, which is, of course, I've learned to ask a long time ago in family practice and in palliative care and in my addiction work. So here's her story. She was a Korean infant given up for adoption at 6 months, at which point she was in a foster home for 6 months. And then she was adopted by an American evangelical couple at 1 year of age, brought to the US. When she was a small child, her adoptive mother, had a nervous breakdown. The father, in a fit of religious remorse, when she was a teenager, confessed to her that he had sexually abused her from age 2 onward. She had no memory of that, no recollection of that. She had repressed that completely. Now, what's that got to do with illness? Well, again, this is quite outside the purview of Western medical practice. although it's nothing new when it comes to insight and understanding, which is that you can't separate the mind from the body. In other words, you can't separate the person's emotional and cognitive existence from their physiology. In 1939, there was a great teacher at Harvard. His name was Soma Weiss. Actually, like myself, he'd come from Hungary. And there's still a day in his honor at Harvard, a research day in his honor. He was considered that great. And he gave a very profound lecture to a medical school class that was published in the Journal of the Medical Association. And he said that emotional factors and psychological factors play as much of a role in the onset of illness as physiological factors, and they must play at least as important a role in the treatment. That was 1938 or 39. That was published in JAMA. In 1977, it was, I think, that Dr. George Engel put forward the concept of the biopsychosocial nature of health, that people's biology can't be separated from their psychology and their social relationships, neither in understanding the onset of illness nor in the treatment of it. So this idea and these insights have been around forever. And in the last several decades, and what I don't have time to do is to review it for you, but please take my word for it. You can check it out later if I'm actually accurate or not. There's been literally thousands of papers showing the impact of emotions on the stress apparatus, on the immune system, the effect of repressed anger on the immune system, on the impact of early trauma on potentiating inflammation that's measurable decades later. As Dr. Rachel Hyuda has shown, the impact of stress on the pregnant woman, on the physiology, on the stress physiology of the infant, which incidentally can be even be traced decades later, according to some recent studies. So now when you understand this, you begin to see that maybe there's some relationship between Miyook's early history and the onset of her illness. Furthermore, I will tell you that in my own clinical observation, which is backed by a whole lot of research done by others, there are certain personality traits that actually predispose to specifically autoimmune illness. And these reflects personality traits, not inborn, but developed in response to trauma and childhood developmental circumstances. People who suppress their anger, their healthy anger. People who are people pleasers, who try to be nice to everybody. People who are identified with duty, role, and responsibility rather than the needs of the self. They're more concerned about the needs of others than their own. People who are afraid to disappoint anybody. Now, this describes Miyook to a T. By the way, it also describes anybody to a T who've ever met, interviewed, or read about with autoimmune illness. And in a very small nutshell, what is the connection? The connection, first of all, is that childhood trauma, as we know, affects telomere length, and telomere length affects inflammation. It affects epigenetics. It, as I said before, it potentiates inflammation, measurably so. And furthermore, these character traits that I described put tremendous stress on individuals. It's very stressful to live like that. That's why my book on this topic was called When the Body Says No, the Cost of Hidden Stress, the stress that people are not even aware of. Now, these are not inborn traits. These are coping mechanisms. They happen when a child's emotions are not understood and accepted and given free expression, when the child has to repress themselves to maintain their relationship with their nurturing environment, when the child has to repress their anger. By the way, the repression of healthy anger, as I said earlier, helps suppress aspects of the immune system. I could go on and on and on. But what I'm talking about is the whole broad field of psychoneuroimmunology or psychoneuroendocrinology, to include the hormonal apparatus in it as well. In other words, we're not talking about separate systems here. We can study them separately in the laboratory. They don't exist separately in real life. The emotional system, the limbic system, the immune system, the neurological apparatus, the hormonal glands, and their manifestations are all one system, and they each affect the other. And that's Miyo's story. No, she drinks the ayahuasca. Not some miracle happens, but what happens is she experiences some entities coming to help her. Now, just to give you a disclaimer here, I've done ayahuasca many dozens of times. I've never had entities come to me. I've never had jaguars, anacondas, or angels, anything like that. I don't know. They leave me alone. But that's okay. I have my own experiences. What I'm saying about Miyoki is there's entities that came to her. Well, what could that represent? I think it represented her true self, the part of herself that was there, the part of herself that Western medicine largely doesn't understand. So when Jeff Rediger writes his book, Cured, on so-called spontaneous remissions, what he finds and what Dr. Kelly Turner finds, she's a psychological oncologist or an oncological psychologist, in her book, Radical Remission, and her researches, and what I found in patients over and over and over again, is that people do have this innate capacity to heal, this wholeness, but largely we're disconnected from it. With childhood trauma, what the plant does or can do is put a person in touch with their innate capacities, hence these entities that help her stand up. And then her healing journey began. She began to talk about her trauma. She began to get flashbacks of her trauma in ayahuasca ceremonies. She began to get therapy, support, instead of being this hyper-autonomous, self-sufficient person, which is typical of people with autoimmune conditions. She started asking for help and started receiving help. So here she is today. Now, by the way, I write up her story in my book to be published in September. If I have the self-serving desire to show it to you, it's called The Myth of Normal Trauma, Illness, and Healing in a Toxic Culture, for which I actually interviewed Dr. Yehuda for my chapter on epigenetics. There are these stories of people that do get better with or without psychedelics, by the way, by connecting to what you might call their true selves and by engaging their own healing capacities, sometimes without and sometimes with the help of the miracles of our modern medicine. Now, where do the psychedelics come in? Well, Sigmund Freud once said that dreams are the royal road to the unconscious. Well, that may be so, but if you read his interpretation of dreams, they're tortuous and almost impossible to follow. But you might well say that psychedelics can act as a royal road to the unconscious. Because as I found early in my work with psychedelics, in my own particular case, they can bring up two things. I mean, how I began working with psychedelics is I just published my book on addictions in the realm of hungry ghosts, where I showed that addiction is not the only, but a prevalent outcome of childhood trauma. All the people that I'd worked with in the downtown instead of Vancouver had been abused as children. This is North America's most concentrated area of drug use. 30% of our clients are Indigenous Canadians. Indigenous Canadians make up 5% of our population, 30% of our addicted population, 30% of our jail population, and Indigenous women make up 50% of our jail population. Why? They just happen to be the most traumatized segments of the Canadian population. They also, Indigenous women have 6 times the rate of rheumatoid arthritis. This is in a population that never used to have autoimmune disease at all. And by the way, in my new book, I talk about this supposed mystery of why women have 80% of autoimmune disease, because in this society, they're acculturated to suppress themselves, serve the needs of others, and ignore their own needs, and to repress their anger. That's my contention. Lots of documentary, laboratory, I should say, scientific evidence for that. But after I published my book on addiction, people kept asking me, well, what do you know about ayahuasca and the healing of addiction? And I became irritated with the question because I just spent 3 years writing this book. Don't ask me about the one thing I don't know anything about. But the question kept coming up until I had an opportunity to experience it myself. And I got it instantaneously. Because the effect of the plant was, first of all, to really open up my heart. I just started crying tears of love. Love is not something we're supposed to talk about in medicine, because you can't measure it in a laboratory. except you can. You can measure endorphin levels and oxytocin levels and so on, and that'll tell you all about love. That's a whole other story. So I experienced this deep love, and I understood how in my own life, as an infant survivor of the Holocaust, I had really closed my heart to love out of sheer self-protection. So that closing of my heart was a coping mechanism, but it also hobbled my emotional life, including with my own spouse and family. Well, when the heart opens, you realize, oh, it's still there. You don't have to run away anymore. But also, these plant experiences can open up to the pain and the source of the pain. In other words, addictions, in my view, or these attempt to be nice and pleasant and good to everybody and suppress yourself, these are all attempts to escape the pain that you endured as a child. And the plant experience can both reveal to you the pain, the depth of it, the intensity of it, but you're there as an adult to witness it with support. And I do have to emphasize the importance of support, whether we're dealing with MDMA, whether we're dealing with ayahuasca or psilocybin or what, it's the importance of empathetic, compassionate, adept support is key. So you're there with support as compared to when you first experienced these emotions as a child, you were all alone. And you're there as an adult rather than a helpless child. So in a very small nutshell again, then, how do these psychedelic substances, in my view, work? They reveal to you what's been hidden to you, which is your deepest sources of pain, but also your innate capacity to overcome the pain. And that, in a word, was Miyoki's path to healing. And that's been the path to healing of many people that I've witnessed, whether from addictions to various substances or to sex or to gambling, whether from multiple sclerosis. And yes, I can tell you lots of stories of people with multiple sclerosis who are no longer on medication and no longer have relapses, or if when they do, they know what to do about them. So what I'm saying is that there's nothing miraculous about any of this stuff. It's all in alignment with intuition, with the intuition of physicians, by the way, over the centuries, including Semmelweis, including Dr. George Engel, what I saw in family practice and in palliative care and in addiction medicine, and with a whole raft of meticulously documented literature about the mind-body unity, about the interaction of these, or the unity of these various systems, and about the capacity of human beings to heal. So I could really talk on several hours on this subject, as you might imagine, but I'll stop here and just see what kind of conversation we can generate.
Thank you so much. Yeah. Dr. Ikuda, would you like to begin?
Yes, thank you so much, Gabor. That was very interesting, and I'm sure our audience has a lot of questions about it. It's really very fascinating. I like case studies, and this one in particular has a lot of really good information in it. You were in a position where somebody tried ayahuasca and then sought your help. But I think what I'm wondering about is, as a physician, under what circumstances you might encourage people to seek out ayahuasca or any kind of plant medicine. It's not something that can be done in the context of Western medicine, for sure. And also, it might not be indicated for people. So is part of the magic of this case that someone found it on their own and you're just helping them integrate the material that they found because that's what's required? That's very different than thinking about prescribing this kind of thing to someone.
I don't quite recall whether I met her online, I should say, before she did the ayahuasca or afterwards. I think it might have been before it. I might have encouraged her, but I honestly don't remember. We have to ask her. But your question is very pertinent. First of all, it's illegal in North America. So, I mean, physicians are not in a position to prescribe it for fear of losing their medical licensure. I myself was still a practicing, I'm retired now from medical practice, but I was still a practicing physician when I began to work with the plant. And I actually got a letter from Health Canada, which is our version of FDA, telling me to cease and desist, otherwise they might call the police on me. Somebody was doing a observational study on my work with Indigenous people. This is again the most traumatized segment of the Canadian population for reasons you probably all know. The Pope just apologized this last week for the church inflicted abuse of Native children for 100 years. It was a very paltry apology, but at least he said, I'm sorry. So I was doing that work when I got this letter from the FDA. So I stopped doing it publicly. I didn't stop doing it. But most physicians are not in a position to do that. So when would I prescribe it? First of all, it's not a prescription. You know, it's a suggestion. Given my view, see, let's take something like ADHD, okay, or depression. You say somebody has depression. Well, how do we know they have depression? Because their mood is really low. Why is their mood really low? Because they have depression. How do we know they have depression? Because their mood is really low. Or Gabor has ADHD. How do you know? Because he's got trouble concentrating. He's got absent-mindedness. Why is he absent-minded? Because he's got ADHD. How do we know he's got ADHD? Because he's absent-minded. In other words, these diagnoses don't explain a thing, people. They describe things, but they're not explanations. The explanations in every case, in my view, go back to life events and a person's reactions to those life events. How a person made meaning out of them, what they made it mean about themselves, about their world, about how they should be in the world, about how they behave. Those coping mechanisms then is what then lead to what we call illness. If you take something like depression, the word itself tells us what it's about. What does it mean to depress something? It means to push it down. Now, what gets pushed down in depression are emotions. Why would a child push down their emotions? Because their environment wouldn't support their free expression of their emotions. So it's a coping mechanism. Now, once we understand that, whether we talk about mental health conditions or physical health conditions, chronic ones, now we know that a mind-body approach that takes into account the wholeness of that person can potentially be helpful. Therefore, there's almost no chronic condition where if it was available and somebody was open to it and had the means to afford it, I wouldn't say it's worthwhile a try. Now, these are not panaceas. They don't work for everybody. And there are no panaceas in this world. So much depends on the kind of help people get. Also, of course, some people should never do psychedelics, as we know, people with history of psychosis or mania, for one thing. They have a real risk of being tipped into severe states. So they're not universally applicable, nor are they panaceas. But for most chronic conditions, I would say they're at least worth considering in the right context.
Even putting aside the idea of psychedelics, the message that you seem to be giving us today is that in a situation where there's a mind-body problem, where there's something that has happened in childhood that manifests itself in a physical or emotional condition, if you treat the underlying experience, if you somehow allow people to give expression to what happened to them, then this will not only help with the mental health symptoms, but the physiologic symptoms as well. And I'm just wondering if there is evidence for or trials in which people approach the treatment of psychosomatic conditions or autoimmune conditions or rheumatoid arthritis or any of those disorders with just the treatment, just trauma-focused treatment alone. with the outcome of improvement to the physical health.
Well, so you're absolutely right. Psychedelics are not required. Psychedelics are like a super agent that can help the process, but they're not the point. The point is that transformation in the individual. And again, I mentioned Jeff Rediger's book, Cured, where he documents these cases of, he goes to the medical histories, the records of pulmonary fibrosis that's supposed to kill somebody and then it goes away, malignancy that goes away, rheumatoid arthritis that spontaneously, quote unquote, remits. I've documented lots of these cases myself, whether it's psychedelics are involved or not. And in most cases, they're not. The key change is what Jeff found, what Dr. Kelly Turner found, what anybody finds is a transformation in that person's relationship to themselves. So whether they did supplements or they did exercise or they did meditation or yoga, and often people do all of these things, the fundamental transformation is in that person's relationship to themselves. In that person's relationship to themselves, in the sense that the rigid, limited, trauma-limited self that they've been living out of, that skin gets shed, that carapace becomes molds, and that person becomes freer and more spontaneously themselves. So that's the key here. Now, as far as clinical trials, that's a different story. Unfortunately, the average physician, I could be wrong, you tell me if this is wrong at Mount Sinai, I'll be delighted to find out. But the average physicians wouldn't have a clue what I'm talking about based on their training. They might based on their experience, not based on their training. The average physician, medical student, does not hear a single lecture on trauma in most medical schools, where they should have a 4-year course on it, given the documented connections between trauma and chronic illness and mental health. So I know about clinical trials, Rachel, but I do know about lots of clinical experience and observation that has been written up. And
yeah, I think that when you talk to medical students and also physicians about trauma and the role that trauma plays in an illness, I think people will readily agree that trauma is a major character. But I don't think that many physicians believe that you have to address the trauma in order to address the current clinical symptom presentation. And I think that's where the rubber meets the road.
Yeah.
And that's what's very interesting about what you're saying, because if a person came to somebody for an autoimmune disease, the doctor might suspect childhood trauma. They might even ask about it, but they may not deliver a different treatment than they would have otherwise delivered, which is based on, medicalized formulations of how autoimmune diseases occur. And so this is a very different approach of saying, look, it doesn't matter what your the manifestation of your current symptoms are. It matters what the origin is. Am I understanding that correctly?
well, no, I'd never tell you to somebody that the manifestations currently don't matter. They're distressing and they're painful. They're disabling. They have to be addressed for sure. But I'm saying, in addition to that, once we've done that, how about we take a longer view of it? Now, the fact is, and I speak to audiences all over the world. My books have been published in 30 languages now, so I do travel all over the place. I ask people, if in the last 5 years you've been to a respirologist, an oncologist, a rheumatologist, gynecologist, neurologist, rheumatologist, any kind of onologist, put your hand up. So a lot of people put their hands up, and I'll say, keep your hand up if they ask you about childhood trauma, current stresses in your life, how you feel about yourself as a human being. What's your relationship like with your significant others, if you have one? Very few hands stay up. These questions are not even asked. And Miyoki, nobody had asked her about any of this stuff. Now, I'm not arguing that we should throw out Western medical science, for God's sakes. But I do know that if we added this scientifically proven mind-body perspective to our approach, we could get a lot of people off their medications. I know one rheumatologist at a major teaching center in the States who says, I totally get it. She read my book and she said, yeah, I totally agree with it. And I'm getting miraculous results with my patients, but I can't even talk to my colleagues about it. And when I talked to Jeff Rediger, who's again the head of McLean Hospital, medical director there, at Harvard, he said at Harvard to talk about the mind-body thing is to jeopardize your career. He says this is changing, he said, but this was true until a few years ago. So I wouldn't paint the picture quite as rosy as you would, that the physicians would agree or they would even ask about it. Unfortunately, it's not part of our training. And it seems foreign to us. And part of the reason it's foreign to us, if I may say, because we undergo a very traumatizing course of training ourselves. We ourselves have to disconnect. A lot of physicians will tell you, if you ask them, my training was really hard. And we learn to ignore ourselves. And then why would we ask about our patients' mind-body dynamics when we don't even know our own? It's not comfortable for a lot of doctors to ask those questions. Not only that, it's time consuming. I mean, if you come to me with your rheumatoid arthritis, and if I give you your steroids and your immune suppressants, that takes a second. But for me to raise the question of your childhood issues, well, and I'm not even trained for it, as the average physician would say. So, and by the way, let me make another quick point here. And this would maybe make us wonder. So, lots of studies have shown, for example, that asthma, the more stressed the parents are, significantly the greater the risk of asthma for the child. So there's something biopsychosocial about asthma. We also know from one study that I know at least, that the more episodes of racism a Black American woman experiences, the greater her risk for asthma. Now, what does that tell us about asthma? It means that it's a well-documented biopsychosocial condition, and that inflammation and narrowing of the airways represents emotional events and interactions with other people. Now, how do we treat asthma? We treat it with adrenaline and cortisol to open up the airways and to suppress the inflammation. What are adrenaline and cortisol? Stress hormones. Across the board in medicine, steroids, stress hormones are the most commonly used medications. But we never ask ourselves, is it possible that maybe, just maybe, stress has something to do with the onset of this condition in the first place? And what would happen if we address that stress? Now, listen, I know I can come across as, I hope I'm not coming across as arrogant, like I know something that other people don't know. I'm just telling you what I've experienced and witnessed and what has been documented and documented and documented. And a lot of clinicians who open their eyes come to the same conclusions. Trouble is they do so in isolation and there's no support within the medical system for their perspective. So that's the dilemma.
No, I think you're bringing in a very important perspective. And I think you're also talking about the helplessness that sometimes doctors feel in Western medicine of knowing that there's something there, but not thinking it's in their domain or not thinking that it's their problem to solve. And, we have a lot of experience with this because we're now integrating mental health into primary care. And it's not that easy just to get the physician to acknowledge or screen for the mental health problem and then partner with us to try to solve it. But the idea of really trying to incorporate the psychological issues and the trauma into the current treatment is very, very challenging for people. Now, when you add on the complexities that psychedelic-assisted psychotherapy may help, at the current time, this becomes even more challenging for people because of where we are. But what I see that there are questions that are starting to accumulate, but I'm very curious about how you first got involved with psychedelic medicines. when did you start integrating this into your thoughts and into your practice? And
Well,
what was that like for you?
very late in the game. Again, it was, I'd worked in the downtown east side of Vancouver. The downtown east side of Vancouver is North America's most concentrated area of drug use. In a few square block radius, we have more people using here than anywhere else on the continent, injecting, inhaling, ingesting substances of all kinds. People live in the streets, they live with HIV, hepatitis C, and I was a physician down there. And I was the physician at North America's, at that time, first supervised injection site, where people actually bring their drugs, their illicit drugs, without fear of getting arrested. We give them clean needles, sterile water, tourniquets, and if they overdose, we would resuscitate them. So that's where I worked. And as I said before, in that area, in 12 years of work, there was not a single female patient I had who had not been sexually abused as a child. And the funny thing was, or the not so funny thing was, until I asked them, nobody ever asked them before, which is astonishing given the many studies correlating childhood trauma and addiction. But again, that's the state of medical training. And it was when I was working there that I wrote this book on addiction. And it was subsequent to that that I told you the story of being asked about what I knew about ayahuasca and addiction. And so that was in 2009 when that book was first published in Canada, subsequently in the States. So it's been about 13 years ago, but it's been a rapid immersion ever since. Just 2 weeks ago, I should say 3 weeks ago now, I participated in a mushroom psilocybin ceremony with some indigenous leaders here in British Columbia. Now, you have to know the conditions of our indigenous people. For 100 years, their children were abducted and abused in these residential schools, sexually, physically, emotionally. The ongoing multi-generational trauma is unbelievable. High rates of sexual abuse of children, high rates of suicide, high rates of addiction, high rates of autoimmune disease I've already alluded to, and so on. So these people are desperate to find healing for their people. So they invited me to work with them in this psilocybin ceremony, which they like to bring to their people because they're just looking for something natural that grows on their lands to help them heal the trauma that they've undergone. I should also pay tribute to their incredible dignity, to their love, to their gentleness, to their spirituality, to their connection with nature. You can't believe it until you see it. So I had the privilege of joining them, and it was transformative for everybody there, including for myself. So for me, it's been very intense immersion, I would say, in the life. It's not all I do. I mean, psychedelics still form a small part of the work that I do, but they're a very intense and highly promising part of it. So it's been about 13 years now.
Yeah, it sounds intense, and it sounds like it's been really very rewarding for you. I'm curious also how long it took to kind of work through the trauma with the patient in the case study.
Years.
I think so I think that's one of the things we talk about a lot in our center, that you can have, it's sort of a paradox that you can have a transformative experience with a psychedelic.
Yes.
But it's the beginning, not the end of a process that can then really take a very long time. And then I'm wondering what your thoughts are about whether the rest of the process can occur without psychedelics. Once you kind of open up, do you need to keep opening up? Or can the rest of it just be about really lifelong integration and processing? Or how long do you think it takes to work through something that has become opened, such as in your case example?
Well, so that depends very much on the individual, is how deeply entrenched the trauma, how early it happened, what kind of support the person has in their life, what resources they can wield or deploy themselves. The key issue is not how many times you do the psychedelics, but what kind of integration is available to you And it really does. I know personally, I mean, I've had beautiful insights and um, states of mind under psychedelics, but if I don't do anything to integrate them, they just become a nice memory. So that's just how it works. There are very few people for whom the experience itself is so transformative that it sets them for life. So that integration, both in terms of practice in your own life and also in terms of ongoing support, is absolutely essential. How many times, there's no prescription about how many times somebody should do psychedelics. Some people do it once and that's all they want. Um, Others, they go back to revisit or to go deep in their experience. Miok is doing ayahuasca again. Maybe I think next month actually in Costa Rica. So she's done it a number of times. It depends very much on the individual, but for most people, it does not need to be a chronic, ongoing process. It's more, what have you learned, and how can you integrate that into your life, into your daily life? And that takes a commitment. It takes a commitment for me.
Yeah. Well, fascinating. You've really given us a lot to think about. Really admire your ability to really put this perspective as a medical doctor and bring it forward. I see that we have questions in the chat, so I'm going to invite people who would like to come up to ask their question. Colin, would you like to ask your question?
Oh.
Does that work?
Yes, I think we'll get Colin up in just a second. Thank you, Colin. In the meantime, maybe I think already up here is our own Hope Krugman, if that's okay. No, thank you. There's so many great questions. Yeah, please keep in comments. Yeah, we're seeing all of your questions and comments in the Q&A, and thank you so much for them. So please, yeah, keep them coming.
Thank you. Yeah, I'll get it started. I know we have a lot of questions here. So Gabor, thank you so much for a talk, starting a discussion we don't get a lot in medical school. I wanted to ask you about something that came up in your talk that also was a central point of a book I just read by Joe Tafur, for which you wrote the foreword, about epigenetics and about the locus of effect of the medicine itself, the ayahuasca itself, but also of the sacred shamanistic traditions being at the epigenetic level. When we talk about washing away, negative energies, these are the traumas that we hold personally and ancestrally. So my question for you about it is sort of a broad one. Broadly, do we think that, we can really home in on that locus with research, and then, more importantly, what do we lose? Is there a way, as we translate it into Western language, that we inevitably lose something of the shamanistic tradition?
When you say locus, do you mean the neurophysiological locus, or what do you mean by locus?
Yeah, well, I mean, I guess it's hard to say exactly because it's the locus of intersection of effects on so many different planes, so neurophysiological and...
Yeah, well, I'll tell you what my response to that is. Your academics is your problem, not mine. I just know that it works, and I don't. If nobody does a stitch more research, I don't. This sounds heretical and looks like I'm sacrilegious here, but I don't care. I've seen it work, and I know how to work with it. So I know. Now let me tell you a quick story, by the way. Shamanistically speaking, this is in. I have a chapter on psychedelic healing in my new book, and this story opens it. You'll be amazed, actually, or perhaps you'll be amazed. I arrived in Peru at this retreat center in the jungle 3 years ago, this June, to lead a retreat. Physicians, psychiatrists, psychologists have come from all over the world to participate in this retreat that I'm going to lead with ayahuasca. Now, I don't lead the ceremonies. I just help people formulate their intentions and then to interpret their experience afterwards. Shamans do the ceremony. We have the first ceremony. So these people came from all over the world, paying fairly big bucks to come to Peru to work with me, and 23 of them. And we do the first ceremony, and there's 6 maestros and maestras, 3 women, 3 men, come and chant to each of us in turn. So each of us get chanted to 6 times. At any one time in the Malacca, in the tent or the building, there's 6 chants going on. and the jungle animals howling and chirping outside. And I'm in my usual mode of everybody else is going to have their visions about, no, me, boy. Try to get through this thick skull. They each chant to me. Next morning, they send a delegation to me. 2 of them. They say, we can't have you participating in ceremony because you have a dark energy about you that our Icaros, our chants can't penetrate. Furthermore, your dark energy affects everybody else in the room. So we can't even help you working with them during the day. So they fired me from my own retreat. Now, don't you know who I am? You know, no, they didn't know who I am. They just knew I was this guy from the north, you know? And they said, you have 2 problems. First of all, we think you've worked with a lot of traumatized people. Now, they don't speak English. They don't know my name. They don't know anything of my publications or my international reputation, none of that stuff. We think you work with a lot of traumatized people and you absorb their traumas and you haven't cleared it out of yourself. Furthermore, they said, we think you had a very big scare very early in life and you haven't got over it yet. Now, when I was an infant under the Nazis in Budapest, a pediatrician came to see me at 1 year of age. And she said, she's never seen such terror in the eyes of a human being as she saw in my eyes as a 1-year-old. And these people picked it up like that. So they assigned one of them to work with me in a private way for the next 10 days. And the others, the other 5 worked with other participants. I won't tell you the ending. It was great for everybody though. That's how important shamanic skills are. Like that, they picked up on my story. And by the way, you know what they said at the end? You will all appreciate this. I don't know if you know this, but when they looked at telomeres of medical students, they fray age faster than other people their age. And what the shaman said was that when they heard that a group of medical people were coming, they thought they'd have an easy job, because when they work with traumatized people, they absorb their traumas, but then they clear it out of each other ceremonially. So they expected that we as Western medical people will have done the same. They said they've never worked with such a heavy bunch in their whole lives. That's what I can tell you about shamanic insight.
Well,
it's crucial.
Self-care is a very big topic in working with trauma. Okay, now, thank you for that. Now, Colin, we'll invite you up to ask your question.
Hi there. So a few years ago, I read a book on depression, sort of describing it from molecular biology to genetics and clinical psychiatry.
Yeah.
And one of the hypotheses that was posited that I found particularly interesting is the idea that stress is a specific mechanism of disease, but the disease itself is non-specific. And so perhaps stress interacts with genetic vulnerabilities to produce a wide variety of inflammatory diseases, ranging from neuropsychiatry to cardiovascular disease. And so I was wondering, in your clinical practice, do you see these comorbidities? And after treatment with psychedelics, do you see the alleviation beyond just the neuropsychiatric disease?
So first of all, in a lot of families, when there's one disease, there'll be other diseases, both of the chronic medical kind and the mental health kind. That's the first point. I think that's because what's being passed on multi-generation is trauma. Now, when you ask about genetics, here's the thing about genetics. For all the belief that, say, depression is due to a lack of serotonin, there's no evidence for that whatsoever. Zero evidence. It's like saying, no, does Prozac or fluoxetine SSRIs work? Yeah, I've taken them myself and they've helped me. But to say that depression is caused by lack of serotonin because an SSRI works is like saying that if you have a migraine headache and you take an aspirin and that worked, that your migraine was caused by a lack of acetylsalicylic acid in your brain. Or if you go to a party and you're shy and you have a drink and now you become sociable, that your social anxiety was caused by a lack of alcohol. So there's no correlation there whatsoever. Number one. Number two, nobody's ever discovered a single gene for any mental health condition. Nobody's ever discovered any group of genes that if you have it, you're going to have a mental health condition. Nobody's ever discovered a group of genes that if you don't have them, you will not have a mental health condition. What they have discovered is a large group of genes that the more of them you have, the more likely to have any number of mental health conditions. In other words, there's nothing specific about them. In other words, what do these genes code for? They code for sensitivity. And the more sensitive you are, from the Latin word sense here, to feel, the more sensitive you are, the more you're going to be affected by whatever happens to you. So you can have those same genes, and we know this from studies. In a nurturing environment, you'll just be that much more effective, that much more present, that much more happy. But given traumas, you'll be that much more affected. That's what's being passed on, is degrees of sensitivity. And that's the only thing genetic. And no, there are some conditions, multiple, I should say, muscular dystrophy that runs in my family. If you have the gene, you're going to have the disease. My mother had it, my aunt had it. But those conditions are very rare. And even if you look at something like breast cancer, there are breast cancer genes, of course, oncogenes, as we know. But out of 100 women with breast cancer, only 7 will have the genes. And out of 100 women with the genes, not all of them will have the cancer. So we pay far too much attention to genetics than they deserve, and not enough to epigenetics and the environments that affect our epigenome. I hope that answers your question.
Thank you.
It does. And to sort of corroborate something that you're saying, so I work actually in a neurogenetics and epigenetics lab, and so I'm quite familiar with the research in this area. And something that I wanted to sort of point out for our audience today is that if you look at the genetic variants that are associated with Alzheimer's, in which specific cells they localize in which regulatory regions of the genome that they localize in, they're specifically expressed and localized in microglia, which are myeloid origin cells in the immune cells of the brain. And so I think that this kind of paints a much interesting picture sort of about the localization of genetic effect in neuroimmunology.
Thank you.
Cool. Thank you. Gary, I think we have time to get your question in. Gary Katzman.
Oh, sorry, I think he's not up here yet. So we can ask it, or we can go to a different question. We only we have just a couple minutes.
Yeah, we only do. I think we can also read this compliment to you by an anonymous Dr. Mate. I just wanted to say that reading When the Body Says No in college was truly life-changing, life-saving. It's truly an honor to hear you speak. What's your advice for doctors in training to push back on the skepticism towards psychosomatic treatment models? Separately, what advice do you give those of us nervous about the impact of engaging with this work in training while processing our own trauma or life?
Well, thank you, first of all, for the acknowledgement. My first advice is to engage with your nervousness. What's that all about? Now, are you afraid of losing your career? That's an important consideration. In this particular world, I cannot push you to do something that might jeopardize your professional status. But you have to make a decision of what's important to you, what matters to you, what gives you meaning. How do you want to spend the decades working with people? Number one. Number two, very often that nervousness is a trauma imprint, that if I express myself truly, I won't be liked, I won't be accepted, I won't be approved of. That's the child situation. So I would say engage with the nervousness first. See what it's all about. Is it a legitimate concern about your professional status? Or is it actually an emotional response to the fear of being disliked or disapproved of? I would say that's the first response. And I would say that most of us, the best work we can do before we can engage with this whole issue is with ourselves and our own emotional relationships to our profession.
Beautiful answer. I don't know, Lauren, do we have time for one more?
No, unfortunately, we're past time. Yes. Yeah, but thank you so much. What a challenging answer too, and such a challenging talk, and helpful and wise. Thank you. And thank you everyone for participating.
So much for joining us, and thank you to our audience. Thank you so much.
Yeah.